Hey guys, how's everybody doing? If you're like me, you're super excited that we are almost done with our second year. I can't believe we're super close. It's ridiculous. But yeah, super stoked about that. Thank you for watching my video. If you're here, I know, like I said, we're all ready for this year to be over. So if you stop by, thank you. Very kind of you. But today I'm going to talk about levomil. Oh my goodness. I'm sorry, guys. I'm going to mispronounce a lot of stuff in this video. I tried looking it up a few times to make sure I got it right, but apparently it's not working. So let me try one more time. Levomilnacipran or Fetzima. Fetzima. There we go. All right, I think I got it. So I'm going to kind of go over an overview for this and kind of give you an idea of what it's for, what it looks like, things you should talk about with your clients if they want to use this kind of stuff. And let's jump into it. All right, so first off, approval history. This drug was approved by the FDA in July of 2013. The brand name is Fetzima. The generic name is levomilnacipran. I don't know why. Yeah, doctors are just mean, in my opinion, for pronouncing these things like this. Dosage form is an extended release capsule. It treats depression or major depressive disorder, which is what I'll be focusing on today. And dosage generally starts around 40 milligrams, and then it works its way up to 120. Finally, the price, from what I could find, it's about $286 for a month, which is ridiculous, but that's the world we live in today. Let's see. It is a serotonin and norepinephrine reuptake inhibitor. It is a dual-action antidepressant. So if you remember that it's blocking the reabsorption of serotonin and norepinephrine back up into the nerve cells that release them. The idea is it blocks and increases the levels of neurotransmitters in the brain. Now, from what I could find, the of the SNRIs was to be more effective than the SSRIs and to try to be better, a better treatment for depression. However, I couldn't find any clear evidence showing that they're better or that they're actually more effective. Instead, I found that they are more effective. They are not more effective, but they are as effective as the tricyclics antidepressants. But they have fewer side effects. So just as effective, just fewer side effects. So that's one thing I could find as a benefit for them. But comparing them to SSRIs, I looked and a few sites said that, yeah, there really isn't showing any if one's better than the other yet. Okay, so next, I said I wanted to focus on major depressive disorder and depression for this treatment. And I guess I just kind of went with this because it matched my presentation in cognitive behavioral class. So first off, you guys know you have to have 5 or more symptoms for a 2-week period altogether. One of these two, either depressed mood most of the day or a loss of interest in activities, one of those two has to show up in the 5 symptoms. And you can show, I think, let me see if I want to say this right. You can either, your clients can share this information with you, or it can be observed by a third party, so like family or friends, something like that can report that. Of course, you might see severe weight loss or severe weight gain. Really, it's not, I think it's 15 pounds in a month, if I remember correctly. Of course, there's insomnia or hyperinsomnia. From when I was working with the clients at this AUSD, any client that was showing depressive symptoms, they always said that they were experiencing insomnia, like they couldn't go to sleep, which I was surprised about. I don't know if you guys have been seeing, but that's where my clients were always reporting, at least. Of course, psychomotor agitation or retardation, fatigue or loss of energy almost every day, just not wanting to go out or wanting to do anything, feelings of worthlessness and guilt, even if they don't really have anything to feel guilty about, struggles to think or concentrate, get things done. You know, you go outside and you have to make a decision, but you just can't make a decision on your own. And then, of course, the one thing that we've all been trained and drilled into our heads, the idea of suicide and suicidation, trying to find the means, trying to find the ways to actually commit it. So constantly trying to check on that, trying to make sure that that's okay. And then, of course, these symptoms are seen in more than one location. So at home, at work, at school, whatever your clientele you're working with, just has to show up in more than one place. And let's move on. So this is kind of I thought this was an important information to kind of share with your client before they maybe look into it themselves. So like, what are some things that you want to consider before taking the drug? So first off, just because your symptoms decrease, it does not mean that you stop taking it. Actually, you'll see in a couple of seconds kind of some of the side effects to just stopping. But that's something that you really want to make sure your client understands. Yeah, just because you feel better doesn't mean that it's okay to just stop taking the medication. You have a set time, a set dosage that you want to get through. And here's a couple of reasons why. First off, failing to take it and constantly, stay consistent can actually increase the possibility of a relapse. So your clients feel fine, or they, take it inconsistently, and then all of a sudden they're going right back to the situation that brought them in the first place. Another thing is a kind of just abrupt stop or a halt in the medications can actually cause withdrawal symptoms. So they could be more irritable, they might experience nausea, dizziness, or vomiting. They might have nightmares or headaches or paresthesia. Excuse me. You never know. Well, you do know, but it's certainly not something that you want your clients to not know about. Another thing is I found some pregnancy concerns. So, of course, major depressive disorder can be really harmful to the mother and the fetus. But taking antidepressant medications during the second or third trimester, and I found it specifically for this one, could actually be detrimental to the baby, as in they might come out a little bit earlier than expected. And so, to put it a little bit nicer, the baby is loading, and then all of a sudden the antidepressant stops their loading and they come out a little bit earlier, and then so they're not fully developed maybe, or something can really be damaging to them. Another thing is, for this drug, it's been tested and shown that it can actually be passed through breast milk. So if you are on this kind of medication, it's something that you want to be aware of if you decide to breastfeed. Here is one of my kind of infomercials sections. So here's some things you want to be aware of when working with your clients. First off, obviously, if you're allergic to it, don't use it. Or if you're allergic to levomilnacipran, I believe it's pronounced, don't take it. And then make sure you're checking with your clients for glaucoma, heart problems, high blood pressure, stroke, bleeding problems, urination problems, kidney disease, seizures, low levels of sodium in your blood, bipolar, any history of depression, manic behavior, suicide in your family, or if you drink alcohol. These are all concerns that could kind of impede on their treatment. So you really want to make sure that it's all okay. Let's see. So I am going to apologize right now because I am not going to be able to pronounce quite a few of the words on this page, specifically the drugs. But I found some medications that could actually increase the level of effectiveness or the effects of levomilnacipran. So I thought this was important. You know, if you have a client who's on any antibiotics and any other antidepressants, antifungals, or anti-arrhythmia agents, or HIV medications, any of these can kind of affect, again, the treatment and how it affects their bodies and their depressive symptoms. And so it's just an important kind of process to make sure you understand these, what can happen. Kind of another infomercial section. You know, if you're 18 years or younger, this is not for you. If you have used any MAO inhibitors within the last 7 days or before 14 days, I think it's between, if you have taken one of these within the last 14 days, it can be a really dangerous interaction, and it could be really lethal to your client. So it's important to know that if they haven't taken anything like that. Also, stimulants, opioids, herbal products or medicines for depression, mental illness, Parkinson's disease, I apologize, migraine, headaches, seizures, infections. It goes on. There's just a lot of outside external factors that could affect the drug, could affect its usefulness, and make it more harmful than beneficial. Okay, so we're gonna go into, I got a couple slides of side effects. There's quite a few. It was kind of surprising to see how much it can affect you when it's supposed to be helping. So first off, nausea, vomiting, orthostatic hypotension, constipation, increased sweating, increased heart rate, palpitation, difficulty urinating, decreased appetite, sexual side effects. And I feel like this is very consistent with most of the antidepressants, but you may not experience orgasms or you have delayed ejaculatory delay. These are just a few of the ones that I was able to find. In this one, these are actually more of the serious side effects. They're not as common, but still something that you want to be aware of, especially if you decide to use this with your client. I found them kind of scary. First off is the serotonin syndrome. This is one of the more common rare side effects that I was able to find, but you may experience shivering, diarrhea, confusion, severe muscle tightness, fever, seizures, and death even. So yeah, a little bit scarier. Increased blood pressure, low sodium, so that it's just headaches, weakness, difficulty concentrating and remembering. So not quite as severe, but still not comfortable. And then finally, angle closure glaucoma. So this is mostly all the eyes, of course. So eye pain, changes in vision, swelling or redness around the eyes. Again, not lethal, but still not very comfortable. And whoa, hey, all right, we're all done. So these are just my references. Again, if you showed up, hey, thank you guys for checking out my video. Hopefully you learned something. Hopefully I didn't just waste your time. But thanks, guys, and thank you, Doc. Hope you guys have a great summer, as short as it is, and see you guys in the fall, hopefully. And stop. Bye.